Welcome to the Dojo. I'm joined by my friend Becki Jennings from Medisure Global, and we're here to talk about travel insurance reimagined, why Medisure Global changes the conversation. Welcome to the Dojo, Becki.
Hey, I feel very privileged to be here today.
Excited to have you.
Excited to be here.
Something we've been talking about for a while.
A while, yeah. We've
Yeah.
been working on this and having conversations for some time.
Yeah.
It's
And
great to be here.
the reality is that healthcare is global, right? This is not something that is happening where we're concentrated in one area of expertise or one area of the country. This is something that's happening throughout the world.
And I think, too, we ought to probably talk about the difference between the typical travel insurance versus medical tourism. And a few years ago, I asked someone, because we talk a lot about travel insurance with our clients, and that's typically if they're going on vacation, as opposed to medical tourism, which is you're on purpose traveling to a different country for a medical procedure.
Well, yeah, and travel insurance, when I think of travel insurance, I'm protecting trip cancellation or
Right.
lost luggage,
Yes.
Or if something happens when I go paragliding,
Right.
I've got some reimbursements coming in any medical bills I might have. But this topic and this particular subject is really about people going out of the country
Right.
to receive medical care, and then when they come home, what happens there, and all the steps in between.
So a few years ago, I was speaking to a representative from a company who has travel insurance that we use quite frequently. And I asked the question, if I have a client who goes south of the border for a procedure and they fall and break their ankle when they're crossing the street, is your insurance going to cover them for that broken ankle if it had nothing to do with why they were there? And the answer was no. It
Yeah.
will not. So I just want to make sure that, if you think that that's going to help you when you go outside of the country for a procedure, it does, in fact does not. Well, first of all, let's talk about vetting. Vetting providers outside of the country. It is more commonplace. There's a lot of things that aren't covered by your traditional insurance, and that's causing more people to look outside of the United States to get certain procedures. There are also some private organizations where you can be a quote member of, and they actually also vet certain things in other countries. And so we now have ways where we're able to vet providers and make sure that they really are sometimes some of the best in the world, but not actually in the United States.
I read a piece recently about people that travel to Turkey for hair implants,
Oh, yeah.
right? And I'm a guy that's thinning up
Potential
top,
candidate.
right? So I go to Turkey. My wife would kill me for actually even thinking about it, but going and getting hair plugs,
Right.
right? I come home and I have some reaction, whether it's
Right.
an allergic reaction, what have you.
Yeah.
What would typically happen at my primary physician if I were to tell them that under
Well, first of
under
all,
my U.S. based healthcare and health insurance
yeah.
policy?
First of all, I think your primary care physician might send you to a dermatologist
Probably, yeah.
or the emergency room. Who knows?
Yeah.
Depends on what you have going on. And the other thing I would say would probably happen is they might say, okay, where did you get this done? And sometimes if you have a provider that is not open minded to the fact that there might be great healthcare in other areas of the world, they could overreact, which could even potentially it could cause you to have more cost of care. And because it's considered cosmetic, I would say you're not going to have any coverage for that complication. And so now what are you going to do? So now anything that you would have done in the US with regard to that complication is going to come out of pocket. And that is an unknown number, right? You have no idea what that cost would be. And so lots of concern for that.
Sure. And more than likely, that specialist. So if my primary sends me to the dermatologist is probably going to send me to the emergency room.
Right.
And you and I both know, because of how long we've been doing this,
Uh-huh.
that is probably the most expensive place to receive care.
Walking in the door is going to cost you a pretty good penny.
Oh, yeah.
And so all the dollars that you saved by going somewhere else, a different country, to get that done, now you've just lost that savings because you weren't prepared for a complication. So if you can prepare for that complication up front and account for that, then your savings actually stays intact and you're able to go see that professional that you thought, you had done the research. When you're going outside of the country, chances are you're doing a lot of research on the provider that you're using. You're checking to see, their star ratings. Let's start with that, right? And you're going to go to their social media. You're going to read what other people are saying about them. You're going to check their credentials, all of those kinds of things. And so you've done all of the work, and this person's, very well respected, written lots of articles, very well known, but even they can't account for a potential complication. And so that's why you have to account for that on your own, because you've accounted for everything else, making sure they're a great physician, making sure they're well respected, making sure they know what they're doing. But then things that we can't control do happen.
For sure, and that happens even even out inside the country, inside the United States. Those things
Absolutely.
happen. The difference, I think, really the biggest difference in the policies are that the site of care, right? And
Hmm.
I think where I see this heading is international centers of excellence. I see those becoming more of a conversation piece inside even employer sponsored plans. What we're talking about here is individuals who decide to go
Right.
outside of their normal course of U.S. based healthcare and U.S. based insurance to travel abroad to have a procedure done at a center of excellence that has been recommended to them or they found through research on their own. And I see that translating over to the employer sponsored plan side. Today, we've got people in employer sponsored plans that are going across the border to pick up medications, or they're
Oh,
having them
yeah.
reimported from Canada, Israel, England.
Right.
There's medications coming back into the country from all sorts of different distribution channels. So this is just I think another step in what is really globalizing healthcare.
Well, you think about it. Just across the U.S. Mexican border, there are about 100 hospitals that actually have the same accreditation as U.S. hospitals. And so when you look at healthcare in that regard, and they're saying they follow the same guidelines, they have the same certifications and all those things. Well, that right there tells you that if that's happening just across the border, it is also happening worldwide.
You sent me an article that stated 1.3 million Americans go to Mexico
Just Mexico.
alone
Hmm.
every year.
Dental procedures. I had a client recently who decided to go to Costa Rica. His dental work was going to be 12,000 in the U.S. He was able to go to Costa Rica, get the same things done with an excellent. Was very pleased with the results. And him and his wife, they traveled to Costa Rica, got the care that they needed, $3,600. And so when you start looking at those kind of savings, you have to think to yourself, well, if I'm going to spend $12,000, maybe I can explore some other options of places that will treat me just as well, have the same results, but I can save $8,000. That's a tremendous savings.
Yeah.
And so not every place is equal. So you have to do your homework. Now, one thing to know when you're going to another country, for example, if you're going to get a cosmetic procedure in Mexico, you might want to understand the credentials of the doctor in this regard. Is this doctor an actual plastic surgeon, or is this an aesthetic doctor? Different criteria, right? So you want to make sure that whoever you're using, whether it's something like this or something a little more intense, you're going to, for example, a heart procedure in Turkey. Those are all important things to note. You did mention on the employer base of this. Let's talk about self insured, large employers who are self insured. And one example is casinos. Casinos, they have people from all over the world working at casinos. And this is just one of lots of different types
Sure.
of employers. But let's talk about how something like this could help an employer like that.
Yeah, I think again going back to the types of procedures that people are traveling for, and if you look through, any list of procedures that are available to folks that are going to travel for medical tourism, you're going to find all the plastic surgery stuff, right? That's probably not covered because of the cosmetic
Right.
piece of it here in the United States. So traveling outside the United States helps people to really curb the cost of those procedures.
Because they're coming out of pocket.
Sure,
Right.
but there are non-elective and elective procedures that can be done outside of the United States in some of those same facilities. So, for example, you mentioned a cardiac cath, right? A
Hmm.
heart cath. But no offense to Minnesota or Oklahoma, but if I'm going to be laid up for 3-4 days, probably wouldn't mind a little more sunshine, a little more beach.
Agreed.
I could easily be talked into flying down to Costa Rica, flying down to Mexico for a total knee replacement by a surgeon who has the credentials. That's and then the recovery time in that space, and then when I come home, my insurance isn't going to cover complications. That's pretty well clear and stated in my policy that it's not going to cover complications from procedures that occurred outside the United States. So I'm going to be on the hook for some of those things. Where a product like MediSure Global, it fixes that, right?
Right.
This isn't taking care of my lost luggage. It's not taking care of my trip cancellation, or my ATV ride through the jungle.
Right.
It's taking care of when I come home and there's an infection in the incision area, or I have some other kind of complication because of the hardware that was
Hmm.
used. I may have to go into the emergency room
Right.
to be reopened and looked at. And in those situations, having an extra policy that protects me and doesn't eat up the savings.
Right.
That's the other key, is that these policies, they typically come at a pretty low cost because there's not a lot of complications from these procedures when people come home. And but having the coverage there just in case, I think is amazing. And when you really put that over a group policy,
Hmm.
you the game changes all of a
Right.
sudden. Now you've got access to care and access to coverage that really rounds out your entire policy.
Well, and let's talk about the employee who's maybe from a different country.
Could be,
That happens a lot.
could be.
And they might want to go home and have that procedure done, or they might want to have the procedure done in the US and go home to recover. And so there's so many different ways that the policy can be used to the advantage of the employer that I think is definitely worth looking at for the employer when these things come up. So let's talk about how the policy actually works. Can you walk us through what happens if somebody has a Medisure Global policy and something happens and now they've had a situation and they've got a claim? How does that work? What can the patient expect to happen on both how they go forth with making the claim, and also how does that claims process work so that they're not out of pocket?
Sure. Uh, in particular, with a complication in the United States, the claim would just be paid for. The patient's going to have a bill that comes in from the provider. They may have to pay that claim initially and then submit for reimbursement through the policy. All the policies are administered through a third-party administrator, Global Protective Solutions, that takes care of all of those claims. They adjudicate just like they would in the United States and pay out whatever the benefit levels are. So they're all, and you can choose from one plan to the other. You can choose different benefit levels, different protections, and all of that information is readily available.
And what type of procedure they're having, it matters as well.
For sure.
So if you're having a minor procedure and you don't need, necessarily you're thinking, "Oh, I don't really want a lot of coverage," or if you're having something, multiple procedures in one surgery or something like that, you might want to have a bigger benefit. And so there is some flexibility with the patient when they select what type of policy they want, what type of coverage they have.
Sure, and if they've got questions or things to add to the claim, there's a claims examiner that they'll have contact with, a representative that can walk them through that claim. But typically, claims are adjudicated in a timely manner,
Yep.
based on the severity of the claim, based on the protections that are built into the policy. Did they exceed the coverage, or are they under the limits?
We
And
hope that people will have these policies and never need them.
sure,
That's the hope.
sure,
But when it does happen, we definitely want to make sure that it goes smoothly and the person, you've already gone through a medical procedure. You may not be feeling the greatest. The last thing you want to have to deal with is fussing with claims. So we want to make that as smooth as we can, and as agreeable as possible for the patient.
sure, sure. And again, it's all done on a reimbursement basis. So unlike some of the U.S. based policies where it's a first dollar coverage, there is some process to having that claim filed and paid.
Hmm.
But from a patient, I think from a patient perspective, it's the peace of mind knowing that the coverage is there.
Right.
Not so much expecting the complications. It's just that knowing that I think the thing that would be a barrier for people in a group setting, and as far as like traveling out of the country for any kind of medical procedures, is just that the standard U.S. based policy doesn't allow for coverage for complications resulting from services that are rendered outside the United States.
Right.
And so those are specific exclusions that you'll find in most U.S. based policies. And so this just wraps around it with some peace of mind to say there is coverage, right? There is coverage, and you can choose the level of coverage that makes you most comfortable.
Hmm.
And looking at the premiums that we've seen throughout this product, they're affordable,
Right.
and they're almost no brainers.
Hmm.
When you're going to travel outside your home region somewhere else to
Right.
have medical procedure done, having that peace of mind, I think, is worth worth it in the end.
Yes. Let's talk about this. Most people, if they're traveling outside of the country to have a medical procedure, they're not traveling alone. So let's talk about what happens with their companion in this case. Is there a way that they can get coverage? Because again, what if they're the ones that's crossing the street and
Yep.
trip and break their
Yep.
ankle? Is there coverage for that person available, and what does that look like?
Yeah, there is. So you've got companion coverage that will cover the lodging. It can
And you have to select
reimburse.
it.
Yep, you have to select it. Reimburses for lodging and any meal expenses. If something happens to your companion while they're there, there's provisions that you can select to have additional coverage for your companion in the event that something happens while they're there.
Right.
So much like a typical travel policy would have, you've got a lot of the same features and components that you'd see in travel insurance. This just adds that whole other layer of coverage for complications.
Right. And if there's a complication and it delays your travel, there's some benefit there as well.
Yeah.
So we have tried to account for every possible scenario we could think of, and we worked very hard at making sure that we could um, account for things that could come up with the patient, potentially with a travel companion, if that's the case. And so we want to make sure that those are all those things are accounted for that we could possibly think of.
There's even an application that a subscription to an app, excuse me, a mobile app that comes with this product that gives individuals access to immediate information as it pertains to global crisis and global emergencies.
Yeah.
With a lot of the unrest in certain parts of the country, a lot of people might have some reservations,
Yeah.
right?
That's a good word.
Different kind of reservation
Yes.
than what they're used to, but may have some reservations about traveling outside the country for medical procedures. And I think for the most part, if we're talking about U.S. based going into Canada or into Mexico or into Costa Rica. Probably not as many reservations as to going across the pond, but if they are concerned about it, there are features built into this product that give them immediate access to any alerts that are coming across globally.
What happens if somebody lives in another country and they want to come to the United States for treatment? Is there care provided for? Is there coverage provided for that? How does that work? Because this is an international product,
Yep,
right?
it is an international product. It does have protections. Again, it covers anybody, anywhere in the world, and it doesn't. There are no borders to this product. So wherever the services are rendered, wherever the complications come from, or wherever the services are rendered after the procedure is done, and they have complications, there is a period of time that they can select in this product that they will be covered back in their home country as well as in the country of or wherever the services are being rendered.
Once somebody selects, they say, okay, I think I need what you're talking about. How soon should they apply for this? Tell me a little bit about the process.
Really simple, right? We've got built a great website
Yes.
at medasureglobal.com that individuals can go online, look at the different options that are available, submit their application, list the procedure that they're going to have, the destination country that they're going to have that procedure, the facility where they're having the
Mm-hmm.
procedure. They can look up facilities to find different accredited and credentialed facilities across the world. But it's a little bit more than the spa my wife gets
Oh,
in
yeah, yeah.
Cancun. So
Yeah.
uh,
Well, one of the things that a lot of people go to Mexico for is a mommy makeover,
that's it, the
right?
mommy makeover.
Yeah, mommy
Yes.
makeover. And
Yeah.
so they may have 3 or 4 procedures in one.
Yeah.
And a lot of doctors also they will make sure if you're having multiple procedures that it's really in your best interest and that those procedures actually are okay to combine. So if you have a good physician that you're working with, they'll be able to guide you to say yes, you can have these 2 procedures together, but not this one.
Sure.
Those kinds of things. So all of those are important.
Where do you see medical tourism, cross-border healthcare, the globalization of healthcare itself? Where do you see that going in the next decade?
Well, I think it's going to expand a lot, and it's going to continue to expand as we become a more global society in general, and it just becomes more acceptable, fewer concerns and worries and questions. You know, one of the things that I did want to bring up, and this is a good time to bring that up, is let's talk about providers, doctors, healthcare facilities, hospitals who are interested in maybe partnering with us so that they could be able to offer this to their patients who are maybe coming in from other countries. Because candidly, one of the reasons that I became very interested in this is this. I was having a conversation with a doctor who resides, has a life, all of the things in San Diego. His practice, however, is across the border in Tijuana. And we were having this conversation and he said, you know, one of the areas of concern is what happens if there's a complication either while they're still in Mexico or when they go home. And he said that that is a concern that they were looking to find something that could fill that gap potentially. And so one of the things that I think is important is that providers understand that we're available. They can reach out to us. We can have conversations with them on how they can actually offer this to every patient that they take care of, whether they're coming from the United States, whether they're coming from Canada or England or pick a country.
Yeah.
We can help them with that. And so we would love to partner with healthcare facilities, with hospitals, with providers all over the world to be able to bring this to their patients.
Yeah, so we could essentially act as a facilitator between the facility itself and the patient
Right.
to explain the product, to make it available to them as part of the entire travel package that they're planning
Right.
for whatever the procedure is.
Exactly.
Yeah.
And I actually am really looking forward to working with more facilities, more hospitals, vetting them so that when a patient is saying, okay, I'm going to go here and get this done, if we vetted them, that means that they have the right credentials. We're confident that they're not going to have complications as much as we can be confident. And that's the hope. And so when we partner with a facility or a hospital, then you can rest assured that we've vetted them and they are going to provide great care.
Sure, sure. The one provision that might be important to know is we in this product you're not going to get approved for coverage if the
It
facility
is a
isn't.
little shady.
Yeah,
Yeah.
if you're going in the back alley somewhere
Right.
to have a procedure done, these are facilities
Legitimate facilities
that
around the world.
even the local population uses, right?
Right.
These are where the local population go. This is just
Right.
getting access to those same facilities.
But the bottom line is what we love about this is the transparency in price. And so when you're going to another country to have a procedure, everything is very transparent. Your travel costs, the cost of the procedure, the cost of your recovery while you're there. And the other thing I want people to know too is typically, if you've never had a procedure outside of the country, let me give you a little bird's eye view of what happens. For example, this provider that I'm referring to, if you schedule some kind of procedure with him, you literally, when you fly into San Diego, you are picked up by someone who contracts with him. They come and pick you up to get you to his facility so that he can, do all the preliminary conversations and documentation that needs to happen. My point to this is you are literally handheld across the border. All of that is accounted for, and you are literally right with somebody through the entire process. Crossing the border, going from the hotel to the hospital to the recovery house, all of those things you're taken care of very, very well. You know, what can they, you're, you generally are fed very nutritious food, not all the preservative foods and all of the
Sure.
things that we might.
They want you to recover. They
They
don't
do
want you
want you to
to.
recover. They
Yeah.
want you to be well, and well on your way to feeling great by the time you leave the facility. It's very well rehearsed, and the infrastructure is all built in to make sure that happens. But there, anywhere in the world, if you're going to a really good facility for this, because their local economy gets a lot of great things happening inside their economy, right? To make this happen, well, they are incentivized to make sure you have a great
Sure.
experience because they want that to continue. And
That
medical
reputation.
tourism
Yeah.
is a big part of their economy.
Yeah.
And so they want to make sure that that happens and everything runs smoothly. So there's a lot of incentives for that. And so you can rest assured when you're using a legitimate facility, going with a legitimate doctor, and all of these things are accounted for, you're going to have a great experience.
So I've got one final question for you.
Okay.
What's one thing you wish everyone understood about this market?
That if you choose to get health care globally, that it could be potentially a great option for you. The caveat to that is you want to make sure that those things that you need to account for, such as complications, are actually accounted for. And your current employer plan or marketplace plan, things like that, may not cover those complications that could potentially happen. And you have the ability to account for that risk very simply by going with Medisure Global and going to medisureglobal.com and looking to see just how simple it is to account for those possible concerns that could happen should you choose to get care outside of your given country.
Wise words. And if you're a broker out there that's talking to self-funded employers about even domestic medical tourism, you should really consider international medical tourism.
Absolutely.
Make sure that's in your arsenal of solutions that you're delivering for your clients. Becki, thank you so much for coming on,
Thanks for having
being in
me.
the
It's a good
dojo.
time.
For the brokers out there watching, continue to learn. I hope you can keep learning. This is an opportunity to really master your craft and sharpen your skills. And I think that something that's really important to remember is mastery is not a destination; it is a practice. So until next time, from the dojo, we'll see you.